Hello there. This is Andrew Kolsky with Therapy BTS, Therapy Behind the Scenes. And today we have an exciting guest on. We have Dr. Elizabeth McMahon. She is a licensed psychologist, and she's going to be speaking with us about anxiety and virtual reality. So, Elizabeth, could you introduce yourself to the audience?
Absolutely. Well, I'm delighted to be here. As you say, I'm a psychologist and I have specialized in treating anxiety for over 30 years. And I've been using virtual reality, VR, with my clients since 2010. It's a very exciting tool, and I'm thrilled to be able to talk about both anxiety and virtual reality today.
Fantastic. And I know that, when you started back in 2010, virtual reality has made a lot of leaps and changes, which I'm sure we'll get to talk about. But I also know that you authored a book, correct?
I did. In fact, I've authored two. So my books include the self-help workbook, Overcoming Anxiety and Panic Interactive Guide.
Hmm.
And then for therapists, Virtual Reality Therapy for Anxiety.
And where can people get those? Are those on Amazon?
Those are both available on Amazon. Um, and I really tried to pour into these books my experience and my blending of what the research shows and what the clinical experience shows, and to make that knowledge really accessible, both to people who are trying to cope with panic and fear and for therapists who are interested in using VR. I also have a blog on psychologytoday.com called Overcoming Anxiety and Panic if people are interested in that.
Fantastic. So you've obviously been doing a lot of work in this field, so we appreciate that. Um, so as we get started here, I know, we mentioned the words virtual reality, and I think a lot of people today, when they hear that, they think of gaming and kids, sitting in front of the computer and doing all these unknown, strange things with these big old glasses, but it's more than that. And so we're going to get to talk about how that technology is used in therapy today. So let's start off with just anxiety in general. What is anxiety?
Well, anxiety is a very broad term, right? It covers everything from panic attacks and phobias to over worry, chronic tension, stress. Anxiety is really a whole person experience. It affects your body, your mind, your emotions, what you do, your actions. So in the body, anxiety can show up as tension or sweating or shaking or your heart pounding or visual changes. You can feel hot or cold. You can feel like you can't breathe or like you're dizzy and going to pass out or like your throat's closing or like you're not present. I mean, it can cause a whole range of things just in the body, right?
Hmm.
And then in the mind, anxiety can show up as fears that you seem to not have much control over, or it can show up as what are called intrusive, repetitive, distressing thoughts that just keep coming over and over and over and over. So you got the body, you got the mind, and emotionally, anxiety can kind of be anything from nervousness to intense worry to fear or even panic and terror. So you
Hmm.
got the body, you got the mind, you got the emotions. Well, if your body, your mind, and your emotions are all telling you that something terribly is wrong, right? You're going to instinctively act as if you're in danger, right? So you're going to take what I call fear based or anxiety motivated actions that unfortunately create a vicious cycle of anxiety. You'll do things like you'll leave when you feel anxious. And then, of course, you keep feeling anxious about the situation,
Hmm.
or you start to avoid. You just don't even go there. Uh, or if you have to go into situations that make you anxious or frightened, you can become what's called hyper vigilant. You're like constantly on the lookout for danger. What's wrong? What's wrong? What's wrong? What's wrong? What's going to go wrong? Uh, you can start to do what are called safety actions, do things to try and make you feel safe from the threat you think is there, But if it's not a real threat, that creates a problem. You can start to do things like repeatedly checking or washing or cleaning or doing things only in a safe way. Um, or you can try and fight the anxiety or fight the thoughts. Like, don't think that, don't feel that. Relax, relax, calm down. Which, of course,
That's
if you're right,
yeah, I'm just thinking to myself, my favorite phrase is when people say, you need to calm down, because that always works.
yeah, right. Oh my gosh, I never thought about that. I'm cured.
Wow. Wow. Well, obviously you're very knowledgeable and very passionate about this subject. And I want to talk about, the realities of what do we do with that. But before we do that, can you just briefly tell us what caused Elizabeth McMahon to become Dr. Elizabeth McMahon, and then why did Dr. Elizabeth McMahon focus on anxiety? Give us some background.
Well, I started out in college thinking I would major in English or music. Um, and then I realized as a pianist, I just don't have the I don't have the hand width to really be a pianist professionally. And I thought, what's pulling me to words and to music? And I thought what's pulling me is that it touches what's deepest in ourselves. It moves us. And I thought, well, that's psychology.
Hmm.
It goes to what is deepest in us, what motivates us, what moves us. And I started studying psychology and I loved it, and started out with a very broad practice, seeing everything. But then I started to specialize in anxiety because the research I was reading was really saying that anxiety disorders can often be treated pretty quickly with very specific, what are called cognitive behavioral therapies. Cognitive, changing the thoughts, and behavioral, changing the actions. And I thought, oh my gosh, anxiety is so common and it can make people's lives so miserable. And there's treatment that works. I want to do this.
Fantastic. Wow. Wonderful. Okay, so then that's a perfect segue into talking about, so traditionally then, what do people do to treat anxiety?
Well, going really back, originally it was thought that every anxiety problem had an underlying cause and that you had to get insight into that cause. And once you had insight, the symptoms would go away. And unfortunately, this doesn't always work, in part because all of those fear motivated actions that I talked about, leaving and avoiding safety and right, create a vicious cycle. And once you got the vicious cycle going, it feeds on itself. So, what we found over time is that the treatment that has the strongest research support of its effectiveness is something called exposure therapy. So, exposure, this is facing your fears, not responding by leaving or avoiding or getting super hyper alert to looking for danger or doing things to keep you safe or fighting the response, sort of accepting the response and being willing to kind of surf through the anxiety while with part of your brain looking for what's the actual reality,
Hmm.
right? So what we found is that if you face what you're afraid of and you act on what the facts are, not what the fear says,
Hmm.
that you start to be less afraid, you start to think about it differently, and as you're thinking and you're acting both change, they both support each other, and you start a positive cycle going.
Right.
uh, and not only that, but if you treat one thing that you're afraid of, it starts to have this positive, this this positive ripple effect. So they even found that other untreated problems got better.
Hmm.
Okay, so we know that exposure works, right? But the trouble is, some exposures are easy to do in a therapy session, but others are difficult or even impossible. And that's where virtual reality comes in.
See, that was you're reading my mind because my question to you was going to be, okay, yeah, I understand this exposure stuff, but if I'm scared of snakes or spiders or airplanes or, any of these types of things, I'm not so sure I want to come to your office and be putting my hands in snakes and stuff right up front.
Exactly, exactly. And there's, VR kind of bridges this gap in therapy between talking about why you should do exposure and how you could do exposure, and then you're out on your own and you're trying to do exposure, or else, I'm bringing a snake into the office, which I'm not so enthusiastic about either. Uh, yeah. So VR is this easy way to gradually, safely start to face the things that you're afraid of.
Mhm. So tell us a little bit about how this actually works. Does someone have to come to your office? Do they need any special equipment? What actually happens?
Okay. Well, actually, I started out with people coming into my office, but when COVID hit, of course, everything transitioned to remote teletherapy, video therapy. And there are now companies that create VR software, VR products for use specifically in psychotherapy that can be used in teletherapy.
Hmm.
Sometimes the client has to have a particular specific headset, or sometimes the client has to pay to use that. But there's at least one company where if the therapist is paying to have access to the software, the client can download a free app on their phone and then can put the phone in a VR headset that holds the phone that you can buy on Amazon for $50 or less. And they open the app, I tap, sign into the website, and I control what happens on their phone. I control the VR as if they were in my office. So now we can do it. I'm licensed to practice in California. I could do VR therapy with anyone in the state.
Hmm. So just to clarify then, the headset that you're talking about that they can get for around $50 or so, that's not the same thing that somebody would have if they were doing gaming, right?
Absolutely not. You do not, to treat a fear with VR, you do not need the extreme reality of gaming VR. If people are afraid of something, it doesn't take much to trigger that fear. In fact, if you go back to 2010, when the virtual environments were very clunky and the avatars were very unreal, it did not matter. The virtual reality is immersive enough and real enough that when you see that steak, or when you're in that small room, or when you're at that height, or when you're in front of the virtual audience, or when you're on the virtual plane, it's enough to trigger the fear, because we want enough of a fear response for there to be some learning to happen, but we don't want so much that the person gets overwhelmed.
Hmm. So tell us a little bit more about the environment from this standpoint. One of the things that I often hear people talk about is, well, virtual reality isn't far enough along yet, so it looks very cartoonish, and so people know that it's not real, and then it doesn't have an effect. What is your experience?
Well, the research is that VR evokes a physical and emotional response and that people respond to it. So that's the research. Okay. But you might say, oh, well, they cherry picked the people. In real life, well, I got to tell you, in real life, the most common response that my clients have after they take off the headset is, wow, I didn't expect it to be so real.
Hmm, amazing.
Yeah,
And is that more recent or is that even since 2010 when you started?
that's from 2010 on.
Wow.
I mean, I was treating people with height phobia where they would go up on the virtual roof. And if I looked up, there was actually like a seam in the sky. And none of my clients ever noticed that or pointed it out or saw it. They're so involved in their own response and and the work that we're doing.
Hmm. Wow. So, okay. So I'm getting the fact that they're wearing this headset, they're looking at this stimulus, whatever the picture, may be. So what do you do with them at that point? How are you treating anxiety?
Okay. Well, let me tell you a story. Let me give you
Okay.
an example.
Okay.
Okay. Um, Let me tell you about Michael. This is someone I wrote about in the Virtual Reality Therapy for Anxiety, a guide for therapists. And I've changed his name and the personal details, so his privacy is protected.
Hmm.
But he came to see me in his 20s when he was drinking a little too much and, a little impulsive. He had a very frightening automobile accident. Nobody was seriously hurt, but they could have been. And that scared him so much that he just stopped driving. And of course, the more he avoided driving, the more frightened of driving he'd become. So he wasn't driving at all. And the idea of driving on a freeway or with passengers absolutely terrified him.
Hmm.
But here he is in his mid 30s, and he's coming to see me for therapy, specifically for virtual reality exposure therapy, because his wife, who did all the driving with their kids, she's got to have surgery.
Mm.
And he's going to have to drive her and the children. So he was so frightened. I started out using virtual reality to just help him calm himself down and learn about the breathing that can calm the body and help him relax the muscles. And I put him in a virtual setting that he found very, very calming and relaxing on the beach. And you know, that just helped him deepen his sense of calm. And then we looked at his fears and explored those to prepare him for exposure, and we talked about the fact that, he's not the person he was in his 20s. He's not drinking. He's not impulsive. He's, a responsible employee and husband and father, you know. So he's not the guy who would be dangerous driving the car, but he is still scared.
Hmm.
So we can tell ourselves we don't have to be scared, right? But there's a lower, more primitive part of the brain that really has to see it, has to learn from experience. So I started out just putting him actually in a VR 3D photo where he's sitting in a car that's not even moving. And his anxiety went up to an 8 on a
Wow.
0 to 10 scale.
Wow.
So we talked it through. We talked through what his fears were, what the facts were. He sat in the car, looked around, gradually came down. And as we did this repeatedly, right, this is exposure, it dropped to 0.
Wow.
So then we started driving in virtual reality. And we started with city streets until his anxiety came down. And then on the highway, an anxiety bumped up, but then we talked it through and it came down. And finally, we had him driving on the highway in different lanes with passengers. And then at night, and then with the rain, until he had done everything that he thought he couldn't do. And he kept reminding himself that he's not the unsafe driver he had been. And he was willing to accept being anxious and knew that he could still drive while he was anxious. And it was fascinating because as we moved through these scenarios in virtual reality, he started voluntarily driving in real life. And he would come in and say, oh, I drive the kids to school, or, I drove around to do some errands. And by the time he was comfortable in all of the VR driving scenarios, he had driven his wife to her doctor's appointment and was driving the kids to and from school.
Hmm. And how long did that take from when you started to when he was actually really driving?
That was, I believe that was 7 sessions.
Wow. Wow.
Yeah.
So that's, pretty amazing. And I'm just wondering, for those people who might still be questioning this, is in your experience, is virtual reality pretty much effective most of the time? Is it just those one-off cases where it helps? What's your experience?
It is nearly always effective. Now, I think it's important to prepare for the exposure in virtual reality by putting into words, by exploring and articulating and questioning the fears,
Hmm.
um, and being able to help the client talk back to their fears in ways that are credible and fact based, looking at the actual evidence. Uh, you know, if if your fear says this is dangerous and the facts say it's dangerous, then you shouldn't do it, right? But most people who come in with any kind of anxiety problem, their fear says it's dangerous, but the facts say there's little or no danger. And your goal is to bring their fear and worry in line with the actual amount of danger.
Hmm.
And we can do that intellectually, but the part of the brain that triggers our fear has got to learn from experience.
Right, right. And I'm finding the conversation to be very interesting and engaging, and it's raising some questions that I bet some of the audience members have too. And here's the next question that came to mind then. So you're describing how you started using virtual reality in 2010. It's now, as of the date of this recording, 2024. And as far as I know, there's still a very, very, very small number of clinicians who actually use VR for anxiety or related disorders. So, with that, then, how did you even make the connection to get into it in the first place? And then, why do you think there aren't more people doing it?
Well, how did I get into it? Basically, I read an article in 2008 that said exposure using virtual reality is as effective as exposure in real life, what's called in vivo exposure, which is the gold standard, absolutely proven exposure therapy that's effective. And I'm like, whoa, I specialize in treating anxiety. This is amazing. So I did a literature review, and there was not much at that time, but it all said VR worked. And then I found two therapists in all of Northern California who had ever used VR. And I talked to them, and they said it worked. And I was able to get what's called an innovation grant. I was working for Kaiser at the time, and they would give grant money for something that was new. So
Mhm.
I got a grant. And at the time in 2010, the equipment was enormous. It was a 3 foot by 4 foot vibrating platform, a separate computer, a wired headset for the client, and it was $22,000 for
Wow.
3 fears.
Oh my gosh.
But people got over their fears in like 3 sessions. So when I left Kaiser, I knew I had to have this for my clients. So why isn't this something that everybody's using? Well, I think part of this is there's just a natural human disinclination to make a change, right? People change takes time. Um, but there is increasing interest. And I have to tell you, I think a lot of this is also being driven by people who have anxiety problems and hear about how virtual reality exposure therapy works. And they're actively looking for therapists. So I'm hoping that as therapists hear about the webinars that I give and other people give, as they hear about the research, as maybe they start to hear from potential clients who are looking for somebody who offers VR. I think there's gradually a wave of increasing awareness
Hmm.
and adoption.
Hmm. So you described this study that you saw in 2008. Um, in terms of as we've moved now into 2024, I know there have been more studies and more research done out there. What are you finding? Are you finding that the new research is supporting the same thing, that it's very effective, or are you finding any drawbacks?
No, absolutely that it's effective. You know, the only area is for war-related PTSD. There's some mixed findings, and if anyone listening is a therapist who treats war-related PTSD, I would encourage them to look at the research by Albert Skip Rizzo, Rizzo. Um, but yeah, no, we now have decades of research supporting the use of VR. And one of the things that I really tried to do in this book was to say, look, you can use VR in so many different ways in your practice. You know, do you want to help clients find a deeper level of relaxation and calm and grounding? Well, being in a virtual environment can deepen that. Do you want to help them learn skills? VR can help with that.
Hmm.
Uh, Positive experiences in VR can lift the mood and be a reward for the hard work that they're doing in therapy. And of course, as a tool for gradual control exposure, it is unequaled.
Wow. Wow. So you mentioned, PTSD as an area that's worthy of additional kind of reading and research. Are there any particular types of disorders, types of clients, types of situations that you would say are contraindicated for VR?
I have rarely found anybody in my practice, which is a practice that focuses specifically on anxiety disorders, especially panic and fears and phobias. I've rarely found somebody who should not or could not use VR. There are a couple of precautions, right? If your client has a seizure disorder or has eye problems or has uh, like a pacemaker or hearing aids, a medical device that potentially could be affected by the magnets or the electronics in the VR headset, um, I would get a release and talk with the client's healthcare provider just to make sure there's no medical contraindication.
Mhm.
Occasionally, I've got clients who are particularly prone to nausea and queasiness,
Mhm.
and um, sometimes they just can't tolerate VR. Um, Sometimes they can only use it for shorter periods of time. And frankly, the biggest precaution that I would say is don't just throw someone who's frightened of something into a virtual exposure before preparing them. Make sure they understand why exposure is important. Make sure you've explored their fears with them and why they're not based in reality. And tell them ahead of time exactly what they're going to encounter in the virtual reality in VR,
Hmm.
right? Tell them what they're going to experience. Make sure they have the skills to tolerate it. Otherwise, you can have somebody overwhelmed and screaming and ripping off the mask, and that's the opposite of therapeutic.
Right. Right. Wow. Yeah, I can just sort of picture that. So, okay, so we've got a couple things here. We know that anxiety is a very common disorder that many people, deal with and struggle with. We know that there are a lot of therapists out there who do treat anxiety and related disorders. We know that the science shows that VR is effective, and you've shared with us some stories where you've used it and how it's worked. So, if a therapist is listening to this podcast and they have never dabbled into VR and they're interested, how do they get started? What should they do?
Well, I'd be thrilled if they got my book. um, because you want to, I would say look at the research, be reassured that this really is an evidence-based effective intervention, a tool. Um, Understand that VR is a tool. It's not some magic therapy that works on its own, right? So know that, you know, treat what you know how to treat and see how virtual reality is going to make your therapy more effective. So in the book, I talk about how you can use it to help with grounding or calm or learning anxiety management skills and practicing them. And I talk through real life case studies about how you use it with each anxiety diagnosis and give a whole treatment protocol with transcripts of how you use it for exposure. Um, you know, go to workshops and webinars. Learn from somebody who's doing this. Um, I have a recorded webinar on PESI.com, PESI.com, on virtual reality for anxiety and phobia treatment. Um, and if you want, you seek out some consultation, maybe just a few sessions with somebody who's experienced with it
Hmm.
to answer your questions. And then go and think about what do you treat? Who are your clients? How would you use VR? And look for a VR product that has the scenarios and the controls that you would use that will help your treatment.
Wow.
And
So,
when you do that, think about actually how you could use the content. So what I mean by that is, let's say the VR company says, "Oh yes, we have a driving phobia environment." Well, driving in a virtual car obviously could be used for fear of driving, but it can also be used to deal with the anticipatory anxiety that someone has when they're in a car and they're driving to a meeting where they have to speak and they have public speaking anxiety, or they're driving to a medical appointment and they've got health anxiety or needle phobia, or they're driving because they're going to getting on a plane and they have flying phobia. So look at the content, but look past the label to the actual content.
wow, that's a great point. I never, thought about using VR in that way, but that's really, meaningful. So then you said something earlier that kind of stuck out in my mind, and I want to clarify it a little bit. You said that when you started with VR, the first machine technology that you used was this big, huge thing, and it was about $22,000. So if I'm a therapist thinking about getting into VR today, is that still where we're at? Am I going to have to mortgage my house to get into this?
Well, equipment can cost thousands of dollars. Like if you get a special chair with wheels and pedals for driving phobia, uh, you know, but on the other extreme, there are VR apps that can run on a mobile phone. I mean, potentially even in a $15 cardboard VR phone holder, you
Hmm.
know? So you can obviously, you can find something in between. And there's going to be a cost for the software. But again, if you get a VR software that you can use in teletherapy, and if you shift to doing teletherapy, you're not paying for an office, and that could easily cover the cost of VR. The
True.
other thing is, if you start to use VR exposure therapy and you advertise that, you make sure that other therapists know that and that the public knows that, I, I can almost promise you that you will get referrals and people will come to you specifically for this. Uh, I mean, at this point, at least 50% of my practice are clients who sought me out because they know that I offer VR.
Hmm. Wow. Well, so, for the audience, you and I are having this conversation in early 2024, and I'm curious because you have had a lot of experience watching VR and other technologies evolve throughout your practice and the work that you've been doing. What do you see as the future? Where do you think we're going? I mean, you hear about AI, you hear about all these different technologies. What do you think is ahead for us in anxiety treatment?
Well, I think VR is going to be more widely adopted. Um, there are there are going to be more VR products, I believe. There are going to be more VR apps, and some of these are going to be marketed directly to the public as self-help. Some will be can be used for homework to reinforce what you're doing in sessions. Some will be used in the office. I'm using that, wherever your office is these days.
Right.
Um, I think it's going to become easier and less expensive to create VR content designed for use in therapy, either by creating computer generated virtual environments or by filming 3D content with a VR camera. And AI, pardon me, I'm just getting over a cold.
Sure.
AI may even generate 3D virtual in content on demand, making it easier to create environments that are really personalized for your client and can make gradual exposure easier and easier. Um, and I think that would be incredible because then you can design exactly what your client needs
Right.
easily and quickly. So I suspect that's what's coming in the future.
Yeah, I see new stories every day about new things that people are doing with these technologies, and it's always interesting to see how they sort of come about and develop new industries that didn't exist just, months ago.
Exactly. Exactly. Um, and I think what I want to reassure therapists about is that however much VR develops, it's still going to be a therapy tool. The relationship with you and the client that makes them feel safe and heard and understood. You're working with them to explore their fears and safely begin to question them and then be able to come up with counter statements that are credible and believable helping give your client the courage to face their fears. That's all what therapists do.
Hmm.
And I can't see, an AI VR product isn't going to replace that,
Hmm.
but it can help you help your client get over their fears more easily, more acceptably, and more effectively.
Right, right. Well, so let me close us out with two final questions for you. And the two questions are related. They are,
Okay.
what is your one comment or tip to therapists about getting into using VR for therapy? And what is your one comment or tip for clients who are considering seeking out a therapist who uses VR?
Okay. So, my one big tip to therapists is start with one virtual environment. Decide what you want to use it for, like fear of flying. It's wonderful for fear of flying. On average, people who come into me with fear of flying, if that's just the one problem, they're back on the plane in 3 to 5 sessions with VR.
Wow.
So don't feel like you have to know all the controls and all the variables and all the environment. Just start small. Start with one. Put on the headset yourself so you know what they're going to see.
Hmm.
And then when you see the effectiveness, then you can gradually move to using more and more environments. So don't be overwhelmed. I'm not a nerd. I've got to be the last person in the world who is still getting DVDs from Netflix.
They still make those things?
They don't anymore as of September. I was so bummed, you know. So if I can use VR, anybody can use VR. So that's my tip for therapists. If you're a potential client and you have any kind of a fear problem, I would really look for a therapist who offers VR. Now, if you're frightened of the fear, if you're frightened of the experience of panic, right? Then, you know, I would say get my book,
Mhm.
because it kind of explains what happens. Why do we get frightened? What's going on in our brain, even though one part of our brain knows that maybe we shouldn't be afraid, and it talks you through what happens in the body and what happens in the brain and in the mind, and what actions make it worse. And it also talks you through a process step by step of being able to cope with that fear response and not letting it control what you do. And if you're less afraid of fear, then facing what you're afraid of becomes more doable. And working with a therapist, uh, you know, is less frightening. Um, in terms of finding a therapist, you might go to the website, VR Therapists International, or you might go to the website svrt.com, and that's Society for Virtual Reality Therapy, svrt.com. And sometimes you can reach out to the companies that make VR. Sometimes they have a list of their therapist customers. Sometimes they don't. Uh,
Yeah.
Look at the websites for therapists in your state. Like, you could look at the websites for the American Psychological Society, the American Psychological Association, or the Association for Behavioral and Cognitive Therapies, abct.org. I think that's .org.
I think it's .org.
Or you could look at adaa.org, Anxiety and Depression Association of America, or you could look at the psychologytoday.com website and just look for someone who offers virtual reality therapy or virtual reality exposure therapy or who specializes in anxiety. So, it may take some work on your part to find somebody, but it is growing. The more workshops I give, the more therapists I see who at the end of the workshop say, I'm going to start using VR in my clinic, or I'm going to bring it to my fellow therapists, or I'm going to, use it in my private practice. So
Yeah.
they're out there.
No, I appreciate all those websites and all, and great information. And I'll just add in for therapists and or clients who may be interested in this. One of the reasons that I even had you on as a guest, and I'm interested in it, is because as a practitioner myself, trying to do exposure therapy, like you said, like for an airplane or standing on tall buildings. Well, there's not a whole lot I can do in my office or even in a telehealth appointment. Sometimes, yeah, I can find a picture on the internet to share with you, which is effective, but there's certain things that I can't. And when you have VR, it's as if the client, the patient, is sitting in the real situation, even though they're not, but they are in their mind. And
Yes.
so it like you said in the beginning, it bridges a gap that has existed in therapy for a while. And I think we're at the beginning stages. Even though VR has been around, like you said, I still think we're at the beginning stages of trying to get it more mainstream,
Yes.
to have the benefits.
Yes. Yes. And you're right. They put on that headset and it puts them truly in a different world. And yet you're with them because you're talking with them. So your voice is there supporting and guiding and monitoring. It's a great tool.
Yeah. Yeah. Well, hopefully we can have you back again in the future as we continue to see this technology, grow and improve and expand. So, Dr. Elizabeth McMahon, you are a true pioneer and expert in this field. We are so lucky to have you share your experiences with us. The book's again available on Amazon. And, I look forward to continuing these types of conversations because I think it's such an important evolution in mental health care. And, more people can have better access more easily. So
Yes.
I think everybody wins.
Absolutely. Everybody wins. Yes.
Right.
Yes.
Well, thank you for taking the time to join us and share your experiences with the audience today.
Oh, Andrea, thank you so much. It's been a pleasure.